more on freeing your body from your medical diagnosis. How does it get any better than that? There's been a lot of buzz on this, which I've been totally enjoying. And how much can we change for you guys with diagnosis in your body? First of all, let me say that I am not bashing doctors. I wanted to have a home birth in my hot tub in the woods in Oregon, and I ended up with an emergency C-section, which probably saved maybe both of our lives, my sons and myself. So I am not bashing doctors. They definitely have a place. And right now, doctors are really up against a lot in the system that they're being forced to operate within. I just had a medical doctor in my last body class, and she was saying that the system expects her to treat patients within 5 minutes, and she just never did really actually fit into that, being a true humanoid. And she was saying how impossible it was. How could you possibly know what was going on with the person and make a correct diagnosis in the space of 5 minutes? So I'm not bashing doctors. They're providing a valuable service, and they're up against a system which is really rigged against them. At the same time, I would like you not to believe everything that someone in a white coat tells you, because there's a lot of errors out there. In fact, every day in the US alone, medical errors, misdiagnosis, misprescriptions, not complications from anything, but just the wrong diagnosis, the wrong drug being given, kill one 747 jetliner full of people every single day in the US. That's the numbers. So there's reason to question what's going on with diagnosis in the medical system. And I'd like to give you some tools to protect yourself and to know what's going on, so you can make decisions for yourself that are really work for you, whatever that looks like. So diagnosis, the word means through knowledge. So someone who's providing a diagnosis should actually have thorough knowledge of what they're diagnosing to begin with. And certainly medical doctors are very well educated, but the time constraints they're under are quite limiting. Another definition of diagnosis that I just found when I was looking it up earlier today is it's identifying things to determine a cause and effect. And as I mentioned in my last hangout, which I think was a week ago, I can't remember, cause and effect is a lie of this reality. Cause and effect is also what everything in the medical diagnosis in the healthcare field is based on. I had a patient come to me, a young man, and really what he wanted from me was for me to give him the name of the structure that was causing the pain in his low back. More than getting rid of it, more than relieving it, more than correcting the cause or correcting the cause upstream from what was going on for him. He wanted to know what was the name of the structure. And if I'd been smart enough to say, it's the L5-S1 disc in your low back, he would have been quite happy. So the whole medical system is based on, if you're the patient, you have a problem, you go to the doctor and you both think it's the doctor's responsibility to give you the answer. What's the cause that's creating this undesirable effect? So that's the system that we're all locked into. And I would like to invite you to step outside of that with your physical body. And that's really what the 3-day Access Body class is about, is stepping outside of this reality with your body. We do a lot of verbal processing, which creates a lot of freedom. But if we don't take our bodies along for the ride, what good is that, you know? We, the being, are enlightened and our bodies stuck left on the curb. In fact, the emphasis on your body along for the ride is one of the great things that's different about Access Consciousness versus anything else that I've encountered. Because, as Gary and Dane say correctly, if it were not a greatness to be in a body, then why was we, as infinite beings, choose to come into body again and again? There must be some greatness in being a body. So what if your body was just as infinite as you are? What if it were as flexible and as able to change as you are? Everything that keeps that from showing up and being real for you, would you please destroy and uncreate all that? So it's the doctor's, in our medical system, it's the doctor's job to come up with a diagnosis, which is an answer and a conclusion. In fact, another definition of diagnosis, really call it a conclusion and an answer. The thing is, as you know, whenever you reach an answer, whenever you make a conclusion, you can't see anything that doesn't go beyond that. I remember my brother-in-law, who was raised in an alternative environment, Finhorn, and his father was seeking alternative treatment for some disease he picked up in the Amazon, which he traveled to. And the son, my brother-in-law, just thought that my father-in-law's choice was completely ridiculous to treat this disease, whatever it was, because he, the medical doctor, the son, knew that the treatment for X was Y. And his father should have been getting Y for the treatment X, and nothing else was entertainable, was considerable, was even worthy or even possible to be considered. And this is someone who was raised in an alternative environment with homeopathy and divas of flowers and all that kind of thing. So it just is an example of how when we focus on what the conclusion is, what the answer is, you can't see anything that doesn't match that. And that's a word of caution to those of you who are using the Access Consciousness tools with your body. When you go, if you find it necessary, for whatever reason, to speak to a medical doctor, please be aware that they're not going to know what you're talking about. Probably the best, if you create miracles with your body, which I see every day with the Access Consciousness body processes, if you create the miracles with your body that we know is possible, your medical doctor isn't going to be able to see it, or if they can see it, they can't explain it. It's not going to fit into their universe in any way. There was a woman who had an abscess in her jaw because some dentist left a sponge in her jaw after a dental procedure, and it got infected, and it literally ate away the bone of her jaw. And Gary did MTVSS right inside the mouth, like this, on the problem, and then she did MTVSS on herself every night to help heal it. And when she went back to the doctor, or the dentist, to get another x-ray, best those dentists could say is, well, we don't know what you're doing, but keep doing it. So it's not their fault, you know. If you were a Martian, you wouldn't know what chocolate ice cream tasted like. It's not the fault of these medical doctors or dentists. But if you go in expecting them to understand what you've been doing with an alternative approach to health and with your body, you're asking a kindergartner to understand calculus. You're asking someone who never heard a word of German to be fluent. You're speaking to them from a universe, chances are very good, they've never even experienced. So they aren't familiar with the healing that's possible with the Access Consciousness body processes and with other alternative techniques as well. So you have to, when you go into them, just know you know things about bodies that they don't know. You are the expert on your body, not the medical doctor. So when is a diagnosis useful and when is it not? A diagnosis is, it's kind of symbolic of everything we're up against in Access. I've heard Gary and Dane so many times complain about how often people come to Access to fix this thing that's wrong with them, and this thing that's wrong with them, and this thing that's wrong with them. And sometimes people in classes even say, but what about going beyond that? What about going into what's the greatness and what else is possible? And that, of course, is where we'd all like to go. But so often we get bogged down into what's wrong, what's wrong, what's wrong. It's almost like if your life had a zero line, a baseline, every single diagnosis, every single pain, every single symptom takes you below zero. As long as you have some symptom like that and you're focusing on it, then it's your job to get back to zero. The diagnosis is that. It's like you have this problem, this symptom, this complaint, this is wrong with you, and this is what we're going to do to get you back to zero. It's not even in the universe of the medical profession to take you beyond zero. It's only fixing this problem, telling you what's wrong, and the diagnosis is the way of doing that. Now, for example, a diagnosis can be useful. If there's something going on in your body and you don't know what it is, it could be very useful for you to go to a medical, if it bothers you enough, to go to a medical doctor and find out what his or her take is on that particular problem. Now, medical doctors are going to assume that if they give you X diagnosis, just like my brother-in-law, Y answer should be followed. And they will be a little bit shocked, sometimes insulted, sometimes stymied. They'll have interesting reactions if you choose not to follow their diagnosis. So please know it is always your choice. Just because they diagnose you with a certain thing doesn't mean that you have to do what they say about it. I learned an interesting thing in a nutrition class, which is if someone's suing for malpractice, you think, oh, you sue for malpractice if the doctor has hurt you. But the doctor is only guilty of malpractice if they haven't followed the standard of care. So if the doctor hurts you, if they even kill you and your relatives sue, if the doctor doing the procedure was following the standard of care, he's not actually guilty of malpractice, no matter how damaging what he did was to you. Now, if the doctor didn't follow the standard of care and you were hurt, then you might have a case in malpractice. But do you know who determines the standard of care that medical doctors are legally obliged to follow to protect themselves from malpractice? Guess what? It's the drug companies. Isn't that interesting? So drug companies come up with a new drug. They don't know how it interacts with all the other drugs the patient is taking because that's never researched. But they determine that their drug is what is now the treatment for this disease. And if you, a medical doctor, don't prescribe that drug, you could be actually sued for malpractice. So if you are assuming that treatment is based on science, you might have another thing coming. There was a study done in the Lancet, a major medical journal in Britain, that determined that only 7% of medical treatments were actually scientifically proved. That's kind of interesting considering that medicine likes to say that it's scientific, but science and medicine are two different things. Science is pure research. This is what happens. Medicine is how it's applied, and that brings you into a completely different medical arena. So it can be useful for you to determine what's going on with your body. If you're stuck, you can't figure it out, to get a diagnosis from a medical doctor. But please know that you have choice. So every place you've made the point of view or the opinion of someone in a white coat greater than yours, more important than yours, more knowledgeable than yours, and more correct than yours. Will you please destroy and then create all that times a bazillion, right, wrong, good and bad, all nine, talk shorts, goals, and beyonds. Now, a medical diagnosis can also be an answer, and that's where it's really incredibly not useful. There's a wonderful Facebook group for people who are body process class facilitators. So those are people who graduated from one of the 3-day body classes that I teach and that other facilitators teach. And they are now teaching 1-day classes in these body processes. And they share on Facebook and ask amazing questions and share amazing miracles, which is so fun to read. But often questions come up. I have this diagnosis, I have that diagnosis. I have autoimmune, for example. And that is not telling me anything. That's telling me that's their diagnosis, period. I always try to back people up from that diagnosis and move them from the answer to, well, what's going on in your body? For example, do you know how diagnoses come about? There's this sort of grid. For example, if you're looking at multiple sclerosis, suppose someone has something weird happening with their eyes, which can be one of the signs of multiple sclerosis. When they go to a medical doctor, the medical doctor is going to ask them a whole bunch of other questions. And it's like there's a grid of maybe 7, imagine a grid with 7 boxes. And if your answers to 4 of the questions in the box are yes, you have possible MS. If your answers to 5 is to 5, then you have probable MS. And if your answers are yes to 6 or 7, then you definitely have MS. So it's literally, how do your answers about your body fit into the box that determine a diagnosis? Isn't that interesting? So much for a diagnosis being a sacred thing. So anyway, I try to back people up to what's happening. For example, in the example of multiple sclerosis, if somebody's having something weird happening with their eyes, I would ask a very different question than if it's somebody who's having trouble walking. So, for example, if they're having trouble with their eyes, I'd say, what are you refusing to see? Or what do you see, what are you aware of that you're refusing to look at? If they were having trouble walking, I would ask, what step forward are you unwilling to take? What is the problem with the feet? A classic access question is, what can you not stand? What steps forward are you unwilling to take? Where are you going that you don't want to go? I would search around for those kinds of questions to determine what's really going on with the person. You see how that moves us from answer, the diagnosis, oh, they have autoimmune, oh, they have multiple sclerosis, into a question. And once you can ask a question, then the verbal tools that we use to process things can work much better. Once it's autoimmune, that's a conclusion and an answer. It may be autoimmune, it may not. And who cares? Is that label something that's useful, or is it more useful to know what's really going on with the body of the person, so you can ask an appropriate question that can allow them to change things? Because a question can change things incredibly. I think I told a story last time about having a headache that was about a 15 on a scale of 1 to 10, and Gary asked me one question, and that one question moved it to being probably 75% better, which definitely that's not possible in the medical way of looking at things. Another very interesting assumption that people make relative to diagnosis is about the limitations of energy medicine, natural medicine, things like that. It's a very widespread, around the world belief that oh yeah, this energetic natural stuff is fine, but if you have something seriously wrong with you, then you should go to the guys in the white coats. So that is a huge way that a diagnosis creates a huge limitation. So every place you've decided, judged, and limited what can be accomplished with your own awareness and consciousness and energetic medicine, will you please destroy it and create all that? Right, wrong, good, and bad, all nine, puck, shorts, boys, and beyonds. Oh, how wonderful. The phone is ringing. And I don't know how to turn it off. So, it's getting better than that. It will shut up eventually. So, boy, it got me to lose my train of thought, however. Yeah, so I wanted to point out that there's all kinds of miracles that have occurred that are outside the realm of diagnosis. Bernie Siegel, who wrote a book about, I think it was Love, Medicine, and Miracles, maybe 30 years ago, he was a cancer surgeon, but he got into the emotional aspect of disease, and he said there's no such thing as an incurable disease. There's only an incurable patient, which is, in a medical way, sort of acknowledging the choice that we as humanoids have. And again, in looking at people who write about the emotional and the personality interactions with diseases that people have, there's example after example of how there's a diagnosis. Maybe someone's diagnosed with breast cancer, and the lab findings are identical. Both women are told the diagnosis, and one of them is dead in a week, and one of them lives for 5 years. They had the same, quote, disease, the same diagnosis, the same treatment. What determined the outcome? It was the individual patient. One of those patients was incurable, one of them wasn't. When you have a disease which looks incurable, that's potentially fatal from the medical way of looking at it, one of the things you can do is ask, what are you dying to get out of? Because most people will be their relationship. 99 times out of 100, that's the bottom line of what they're trying to get out of. But don't conclude that, don't diagnose that, ask a question, what are you dying to get out of? And another great question is, what's the value of this? Because a disease which may look horrible to us, like multiple sclerosis, for example, a lot of times what those people value is not having to work. Even though their disability check may be very small, it may be more valuable to them to get that check every month than to have to work. So, but you don't know. But if you ask the question, you can find out. Now, if you say, what's valuable about cancer or what's valuable about multiple sclerosis, the person's going to say nothing. The bird of cancer just landed on my head and made a big shit. No, if they have that point of view, then that's the person that you're not going to be able to do very much for, because they're not willing to have any responsibility for what they create. If you keep asking the question, because everyone will say there's nothing valuable about it at first. If you keep asking the question, then you have the potential to get to their crazy mind answer. And when you can get to their crazy mind answer, they can see where they're creating the disease or the symptoms or the discomfort from. And that presents with them the choice of changing it. Will they change it? Their choice, not yours. But if you ask the question, so what are you dying to get out of? What's the value of whatever disease they're dealing with? And what do you love about having this disease? You can often hear some really interesting answers to those questions, and it invites people to acknowledge their choice in what's occurring to them. So I talked about when a diagnosis is useful. That's when, if you can't figure out what's going on with your body, sometimes it's useful to go to MD and get a diagnosis. But remember, you have choice. You don't have to follow their treatment for it. But once you have the diagnosis, you can go backwards from that and say, okay, this is what's happening in my body. What would it take for that to change? So sometimes a diagnosis can give you something useful. When it's not useful is when you take it as an answer, because every answer or conclusion stops anything that doesn't match that answer or conclusion from showing up in your universe. And in that way, a diagnosis can be really limiting. Like the person who's doing fine, suddenly they get a fatal diagnosis, boom, they're dead. That diagnosis wasn't really particularly useful. So whenever, actually, I'd say the bottom line is whenever a diagnosis gives you more information to ask a question about, that's when it's useful. When it's an answer that limits your choices, then it's not useful. So of course you can use the access tool. If someone gives you a diagnosis and you don't know whether to believe it or not, you can use the tool of, oh, does this feel light or heavy? Because what's light, what's true, will always feel light to you. So, and even if it's a potentially life-threatening diagnosis, which is not a good outcome, if it's light, then there's a good chance that it's actually true. Gary Douglas, the founder of Access Consciousness, tells the story of asking if his mother was going to die, and it felt light to him. Now, it's not that he wanted his mother to die, but his mother was choosing that. And because she was choosing that, it was something that was true, and so it felt light to him. So light is not just a diagnosis or an outcome that you like. Light is something which is true or correct, whether we like it or not. And likewise, if something's heavy, then you can ask the question, where's the lie here, spoken or unspoken? There's a lot of lies in medicine, so you don't have to tell the doctor that you think they're lying. I've been tempted sometimes, but it's a good time to use just for me, just for fun, never tell anyone, and then just go and make your own choice once you get the information. So if a diagnosis is a lie, if it feels heavy to you, if it's a conclusion or an answer, then it might be something you might choose not to base your actions on. If it feels light, then there's a good chance that it's actually correct, and you can go, okay, how can I use this information to my advantage? What further questions could I ask my body about what my body requires that I haven't been giving it, doing for it, allowing it to do, or whatever? Because your body has opinions about things that are different than your opinions about things. Now, for example, take the subject of food. Every week, every month, there's a new diet that comes out. There's a new food that's healthy, like right now it's kale. Kale's like the be-all and end-all. You can cure the world with kale. Personally, I don't especially like kale. I'm kind of with George Bush on broccoli, and kale kind of fit in the same category as far as I'm concerned. But anyway, kale's the in thing. But it's not about believing what someone else says, because what makes them more knowledgeable than you? And it's your body that eats, not your mind. So you can read with your mind in the magazines about how healthy kale is, but your body may or may not use it. That's one of the reasons we recommend in Access. Ask your body what it would like. And your body, like you the being, changes every single day, which is another diagnosis, another way the bodies are that medical doctors don't acknowledge. Medical doctors, for example, think that you should take the same dose of something every single day. It should be reliable, it should be standardized, etc. For example, they don't even like, there's a supplement that I used to use a lot that was based on actual thyroid glandular that supported the thyroid of people. And the medical doctors didn't like that because they didn't know that it had a uniform amount of thyroid hormone in it. They would rather take a chemical which wasn't actually really thyroid hormone, because thyroid hormone can't be patented by the drug companies. They'd rather take a full thyroid supplement hormone, which could be standardized, than one that had a little variation in it. And what they also don't recognize is that your body may need a lot one day and not very much the next. For example, I had a woman with diabetes in a body class that I did. And so I suggested some processes to her partner that she could do on her to change what was happening with diabetes in the body, which is an unchangeable thing in the medical world, especially type 1 diabetes. And so her partner did those processes, and the next day the woman asked her body, and she was taking 2 different diabetes medications, and her body wanted neither of them. Cool, how's it getting better than that? Then the next day she asked her body, and her body wanted one of them and not the other. So if you're willing to ask questions about your body, you can go around an incorrect diagnosis or an incorrect prescription that is provided by somebody, even somebody in a white coat. So how does it get any better than that? Always ask questions, because your body has a lot of wisdom that we don't necessarily acknowledge. We tend to be influenced by TV. I love to see what people's judgments of what a healthy food and a not healthy food is. It's really fun to watch all that. But that's all us. That's not what our body requires. So the emphasis on diagnosis it's much more pervasive than we think. For example, I mean, even Gary, I would say there were some aspects of that he hadn't actually become aware of, because I remember him saying to me, when I had a chiropractic practice, I had a message machine and it said, have a healthy day at the end of or something like that. Something about being healthy at the end of the call. And Gary's comment was, well, if they were having a healthy day, would they be calling you? But see, that's actually coming from a medical point of view about the body. Oh, you're a chiropractor, they're going to be calling you if they're in pain or they have a problem. If they don't, they won't. And the whole thing about what I've been creating with chiropractic, with everything in my life, is creating a new possibility for bodies. What if they were calling me to stay healthier? Which is a great reason to call a chiropractor, because that is actually our training. It's the basis of what we do. I'm not selling chiropractic or not. I wouldn't give it up myself, but I'm just pointing out it's a different way of thinking. It's looking at what's right about us and how can we make our bodies functioning even greater, which is a wonderful reason to go to a chiropractor or any practitioner of energetic medicine. What if you didn't have to wait to have something wrong to do something for your body? What if you lived in the question, oh, body, how can we have more fun? How can I make being in you even more fun? What can I do for you? What would you like today? How can we create even more greatness together? What if we were to live with from those kinds of questions with our body, rather than, well, I've been diagnosed with this and this is what's really wrong with me? What if we were to get way beyond that line, that zero line, to the greatness of embodiment? And that's what the body processes, all of Access Consciousness, but the body processes are about, because they're about bringing us to a place where we can go beyond that limitation. So I want to point out some of the people that I actually know who've been healed of incurable diseases using the Access tools, the verbal tools, and the hands-on body process tools. I have a friend who I am 99.99999% sure had ovarian cancer. I actually was in her physical presence. I palpated her abdomen. I felt what it was like. And Gary actually kept telling her to go see a medical doctor, because this was someone who in her life had relied quite a lot on medical doctors. And she kept saying, no, I want to heal with Access, I want to heal with Access. And she used the tools, and she had a husband who was willing to do lots of body processes on her. So she did that, and finally what her body required was to have a tumor actually removed. And what they found when they did the surgery was they found 35 other random sort of tumors in her body, which they removed and sent to Stanford. Now, I've checked this out with a medical doctor, and we've never heard of anyone having subsidiary tumors from any kind of tumor that wasn't malignant. But when they sent those tumors to Stanford University, Stanford said, this is very interesting. I haven't seen anything like this. So just an example of how the Access tools can be used to change something that's incurable. Because this woman's still alive 10 years later, and the survival rate for ovarian cancer is like 1 in 500 5 years later. So if it wasn't for the Access tools, she would have been long gone. There have been other people who had, more than 10 years ago, had stage 3 bone cancer, which is go home and get your affairs in order time. And when you come back in 8 weeks, then you'll be in stage 4, and then we can justify the invasive procedures like bone marrow transplants we're going to do for you. However, this person's wife phoned Gary And he said, do MTVSS on the joints of the spine, because MTVSS, which is one of the body processes we teach, has a dramatic effect on the immune system and a dramatic effect especially on the joints of the spine. So the woman did this every night. She put her hands on his spine. She falls asleep. Her hands fall off. She puts it back when she wakes up all night for 6 or 8 weeks. And when she went back to the hospital, they said, you're in remission, which can't really exist in a diagnosis like this. So the person actually had to be misdiagnosed in the first place in the medical model. AIDS is incurable. So if you actually cure yourself of AIDS, which has occurred, you must have been diagnosed in the first place, because it's not possible to cure yourself of AIDS. That's diagnosis as a limitation. Anyway, this guy's alive and walking 10 years later of stage 3 incurable bone cancer. So there's another example. Bladder cancer, breast cancer, all kinds of cancers have responded to the access consciousness body processes. So everything you've decided is incurable, unhealable, terminal, only overcomable with drugs about whatever you've been diagnosed as, will you please destroy and uncreate all that? Right, wrong, thing, bad, all nine, complex shorts, boys and drowns. So I got a very interesting question. I don't see anybody sending questions to the best of my ability to pick them, but I got a very interesting question in advance from a woman I don't know. And for obvious reasons, her name will be anonymous. But anyway, this woman reported, according to her, is pregnant for longer than someone can actually be pregnant for. Now, 95% of babies are born within 2 weeks, 2 weeks before or 2 weeks after their due date. This woman's gone long past her due date. What should she do? This is a really interesting question, and I bring it up because it's an illustration of how we can use Western diagnostic methods with what we know that you are really the expert on you. Now, if I were a medical doctor, I would say, that's impossible. You can't possibly be pregnant that long. If you've been pregnant that long, you can't really be pregnant. That's a conclusion. And that's a complete negation of what she knows. For me, what I would say is there are really easy diagnostic procedures that are available in Western medicine to determine if you are pregnant or not, especially if you're pregnant full term and past term. She does have the swelling and blah, blah. Anyway, so I would suggest that you go in and have an ultrasound or an MRI, not a CAT scan or a X-ray, because those things would expose the infant to radiation, which we really don't want to do when it's growing. But why not? I'm trusting her experience, even though it fits way outside of medical knowledge or scientific knowledge. So I'm acknowledging her experience. At the same time, I'm suggesting that she use Western diagnostic methods to find out what's really going on and also see what's like for her. But with imaging, if it's a pregnancy and you're trying to determine is the person really pregnant or not, it's not really so much of a mystery. You can get an ultrasound, you can get an MRI and find out, is there a baby in there or not? And if there's not, then we could ask some interesting questions. What do you love about not being pregnant? What do you love about being pregnant? What does it mean to be a mother? What's the value of having a pregnancy that goes so far beyond term? All of the regular tools we could use, the regular questions we could ask someone about what's going on in their body would apply to this question as well. So I hope that's helpful to you, the person that asked the question, and trust what you know, and at the same time, be willing to get the diagnostics done that are actually going to let you know what's going on. Because if you're pregnant way past term, then something interesting is going on with your body, or something's going on with you that you're not acknowledging. You could also ask, especially if it turns out that you're not pregnant, okay, what do I know, or that I'm denying I know, or what do I know that I'm pretending not to know? So what's if she's gone, quote, past term and she's not really pregnant? That's a really interesting creation too. And what's the value of that? And everything that is times about zillion, we destroy and create it all. Everyone good and bad, all nine, cut, shorts, boys and beyonds. And as always, I would say you are the expert on you, which is the premise of Access. Access Consciousness is about empowering people to know that they know, and you do know. The thing is, when it comes to your body, like for some reason this woman really wants to believe that she's pregnant. I'm not telling her she's wrong. I'm just saying, okay, let's find out what's really going on, so we can act on what's going on, not what we think is going on, and go from there. So I hope that's helpful. Just looking at my notes here. I think I'm a little bit out of what I have to say on the subject. I could actually talk about the way we think about bodies and alternative ways of looking at bodies and getting out of medical programming. I could talk for a long, long time about something about that. But today's subject was just looking at the process of diagnosis. And unless there's a question that comes up, I think I'm going to keep it at that. I've been one hand talking for, one hand clapping for about more than half an hour here. So lots of getting better than that. And I hope that all of you who got what you were looking for, and feel free to send me questions to spread this around, and maybe we can make this into an ongoing class and answer some questions people might have about specific diagnoses they have, or specific things that are going on with you and your health. I'm just making sure there's no questions. Okay, cool. So this is Dr. Kacie Crisp. Thank you for joining me on this talk, and I'd love to see you at a foundation and level 1 classes, which prepare you to do the 3-day body class. I have a 3-day body class coming up in Israel in September, one that I think is going to be huge in the Netherlands in November, and I'd love to come to your neighborhood and present one to you as well. So how does it get any better than that? And thanks for joining me. Thanks for considering something outside of the box, where you can perceive your body as a greatness and an infiniteness, not a limitation. Thanks again. Bye.